Hello, everyone. Thank you so much for joining our quick educational session on vaccine recommendations for people with spina bifida and how to return to school safely. It is back to school season, so that means we're going to be in close quarters, germs are going to be flying, where you just want to make sure that everyone is safe, they're healthy, they're protecting themselves, they're protecting their families, their communities. So here with us today is Dr. Ellen Fremion, here to chat about vaccine recommendations. So, Ellen, would you like to introduce yourself?
Sure. So I'm Ellen Fremion and I'm from Houston, Texas. And as it says here, I did internal medicine for adults and also pediatrics in my training. So I take care of adults and kids, or kids from 1 to 92, as I like to say. And I particularly take care of adolescents who have spina bifida, as well as adults with spina bifida. And I also take care of other adults with developmental disabilities in a primary care setting here in Houston, Texas. So happy to be with you today.
Perfect. Thank you so much. So let's jump right into it. First up, we've got tips on how to prevent illnesses.
So a couple of the tips that are listed here and have some graphics are just wellness tips. Wellness goes a long way for preventing infections, and they're just common things that you already know, but are good to know that they are really effective. So the first thing is wash our hands often. So we really want to teach our children to wash their hands before they eat, after they use the restroom, maybe when they come home from school, and then, whenever they cough or sneeze and accidentally use their hands instead of their elbow. Good to always wash your hands, and also keep your hands away from your face and touching your mouth, because that's where germs can enter into our bodies. The next thing is sleeping well. Sleep helps our immune system and helps us to feel better overall. And kids and teens actually need about 10 hours. Some people need a little bit more, some people need a little bit less, but we should kind of look at the clock and make sure that our kids and ourselves, when we're this age, get about 10 hours. Adults can drop that down usually to 7 or 8 hours, but while we're growing and our brains are really working hard at school, sleep is very important. The next is to eat healthy. So make sure we get our vitamin C with our fruits and veggies, good protein to help our muscles be strong. So a healthy diet goes a long way for our body's immune system as well. And then, as it says here, just a reminder to try not to touch your face. And your eyes, your nose, your mouth are all places where germs can enter into your body. Exercise is really important as well. So the recommendation, if you can make it to the gym or to go for a walk or roll with your family or use a YouTube video, is my preference, to exercise about 30 minutes a day. Next is sunshine. So the sun gives us vitamin D. So about 15 minutes per day of sunshine can give us adequate vitamin D. Sometimes your doctor may check your vitamin D level and recommend that you take an extra supplement of vitamin D. And there are some studies that show that very low vitamin D can make you actually at higher risk for lung infections. So we don't need to have hyper supplements or over the recommended amount, but if the level is low, that's where we may need to take a little bit of extra vitamin D to help our muscles and our bones to be strong, as well as support our immune system. And then stress. So stress can affect us all. Children experience a lot of stress when they go to school, whether it's meeting new people, dealing with social anxiety and friendships, or just going through the routines of studying, doing homework and tests. So it's really important to kind of check in if you're a parent with your son or daughter, or with yourself, if you are a person going to school, and say, like, how's my stress level? What are some ways that I can bring my stress down through coping strategies like deep breathing or counting or using to-do lists and celebrating my wins? Those can all be helpful strategies to decrease stress, which may also make us more susceptible to illness. And then lastly, we're going to spend some time on this in a bit, but we need to stay up to date with our annual wellness visits. Those, I call them the birthday visits, where you go and check in with your doctor to make sure you're appropriately growing, that everything is healthy and strong, and that you also get the opportunity to get your vaccinations that prevent illness.
Perfect. Thank you so much for these helpful recommendations. I know I could get out there and use some more sunshine, so thank you. Next up, we're talking about important vaccination ages throughout your life.
Yeah, so vaccination schedules are difficult to understand. We spend a lot of time even in our training as doctors and nurses understanding when people should get what vaccination. But these are the important ages to remember. And sometimes I'm a parent too. I have to remind my kids like, okay, this is probably going to be a vaccine visit. And, we're going to do this and different strategies to be strong and to get through our vaccinations. And then we'll celebrate with a treat after. That goes a long way in my house. But these are the important ages. So we all remember that babies get a lot of vaccinations to protect them from infections and prevent hospitalization and illness that actually used to kill babies. So now we have vaccinations to prevent all of those illnesses. The next age is the 4-year shots. And this is, again, when I talk to my kids about like getting your vaccinations, how we're going to be strong. We can blow out birthday candles. And then afterwards, we're going to celebrate with a treat when we show how strong we are. The next age is at 11 years old. This is when we get our up-to-date tetanus shot. We start talking about the HPV vaccination, which prevents cervical cancer, and then just make sure that all of our other vaccinations of childhood are up to date. At 16 to 18, we're looking at preparing for graduation from high school, potentially going off to college. And this is where we get updated meningitis vaccinations. And again, make sure that all of our other vaccinations are up to date before we go off to higher education opportunities. As an adult, fortunately, the good news is that you need less vaccinations at the time, but we need to make sure that our tetanus shot is up to date. So that's the Tdap here. And you get that every 10 years. And actually, it's recommended for pregnancy for women because it has that P in there, which is pertussis or whooping cough that little babies can get and make them very sick. The pneumonia vaccination is a little tricky. It depends upon what your risk factors are. So if you have heart or lung disease, that may be recommended for you at a younger age. Otherwise, everybody gets it at 65. And again, HPV is the cancer preventing vaccination for cervical cancer and warts. It's recommended for both men and women. And so it depends a little bit upon your age as well as your risk factors. And lastly, zoster. Zoster is the one that prevents shingles. If you had chicken pox when you were little, hopefully the next generation of folks growing up that are a little bit younger than myself will not have chicken pox because we now vaccinate for that during childhood, but zoster prevents shingles for older adults. And then we all need our annual flu vaccination, and that's really important when we go off to school. So that vaccination comes and is available usually in the fall of each year. And then I put a website there at the CDC if you want to learn more about vaccine schedules and what's recommended per age.
Perfect. And the one vaccine we're missing here is COVID-19, and we're going to talk about that in the next slide.
So COVID-19 has really changed the world and how we receive medical care, what we talk about with vaccinations. There's been so much information out there in the news and on social media, as well as other information from the CDC. It's sometimes really difficult to understand what the information is. And it's also been a little bit of a moving target because before 2020, we didn't really, in 2019, we didn't really realize how bad COVID could be. The COVID-19 virus is a derivative of the coronavirus, and coronavirus is one of the cold viruses that we just had in our community and didn't really recognize until we got this mega virus that caused a lot of deaths throughout the world. So if you look at this first graph here, it shows the number of deaths per week in the United States throughout the pandemic. And the good news is, as you look at the end of the tail here, thankfully, the deaths from COVID-19 have drastically reduced from when we first saw the virus and then had the Delta wave in 2021. However, the COVID vaccination has changed over time. And the reason for that is that the virus itself has mutated and changed. So the COVID-19 virus that started the pandemic is not the same one, thankfully, that we have now in our community. So similar to how we get a different flu vaccination every year, we now need a new updated COVID vaccination. So it's not that the other one was bad or they gave us misinformation about the other vaccines. It's just that the virus itself in our community has changed. And so the folks at the CDC and the FDA that are recommending the vaccinations have noticed that we have to update our vaccine and what the vaccine is so that we can prevent illness. So a couple of tips about the COVID vaccine. First, the COVID vaccine has been the most effective thing in preventing serious illness. So that means hospitalization and death in this pandemic. And it also may shorten the course of illness. Unfortunately, we've noticed that the COVID vaccine immunity, how it helps your body fight off the virus if you are exposed to it, is most effective for only about 3 months. That also means that if you actually get sick, unfortunately, with COVID-19, that maybe you can wait, and this is in the CDC website, you can wait about 3 months until you actually get the next vaccine, because your body may already have its immune system built up to recognize the virus and fight it off if you are exposed again. It is okay to receive COVID vaccinations along with your other regularly scheduled vaccines that we talked about previously. And it's good to know that there is a vaccine schedule, and it really depends upon your age as well as what other vaccines you've previously gotten. And the CDC continues to update these recommendations as the new vaccine formulations come out. So with that, there is a new vaccination formulation expected this fall. And it is the variant that they think is most prevalent in the community and is expected to be the most prevalent this fall. So that is expected in September of 2023. I think a lot of news is also giving out this information, and you can check with your doctor about when this new vaccination formulation will be available for you.
Absolutely. Thank you so much. That's so good to know. Lastly, we just want to reiterate how safe vaccines are for people with spina bifida.
Yeah, so people with spina bifida really don't have extra risks for receiving their regularly scheduled vaccination. And for these children, it may be more important that they actually receive their vaccination and prevent illness. Some people with spina bifida also have some lung disease that may make them more susceptible to respiratory illness, for example, and may make them very, very sick. It also causes us to miss school when we're sick and not feeling well. And that can be a big setback for our socialization and all of our learning that we need to do. So this slide kind of talks about how vaccines have gotten better with technology over time. So back 30 years ago, like when I was a kid receiving vaccinations, you can see that the antigens, or the little bit of the virus, the dead virus usually, that they give in the vaccine to make you have a memory of that in your immune system. We used to get a lot more of those particles, like 3,000, right? And today it's down like to 300. So we can use less of the virus parts in order to make our immune system create a memory of what that virus is, and then be ready to fight it off if our bodies are exposed to it. So vaccines, we're continuing to study them. We're continuing to do trials to make sure that they're safe and effective. So if you have any questions about that, again, you can seek the CDC's website, as well as talk with your doctor about personal questions that you may have or concerns that you may have about vaccinations.
Perfect. Thank you so much, Ellen, for joining us today. This is very informative, very helpful. Again, if you have any questions, you can visit cdc.gov. You can talk with your doctor. You can visit vaccines.gov to go ahead and schedule a few of these vaccines near you. And we hope you all have a great back to school season. Thank you so much.
Thank you.